Hey guys, welcome back to the show. You're listening to the Ancient Health Podcast, and I'm really excited to be jamming out with a girl that is really quite the personality on social media, but she is not only entertaining, she provides so much value in terms of what she is delivering content on. So I am joined today by a fellow knee. I call the knees because my best friend in just childhood was a Whitney, and we called ourselves the knees. So I'm Courtney, she's Whitney.
I love that.
Totally random, I realize. But I'm joined by Whitney DeFogio. So if you don't know her, you're about to know her. And if you have kids, you should definitely just point them to her YouTube channel and all of her social because it's so entertaining. As I was walking through all of your different, all the different subject matter that you do, I'm like, this is actually really interesting. And you make dentistry very fun and easy to digest. We've had a lot of different experts in the field of biological dentistry, which are fantastic episodes, but I'm excited to get your perspective of how people can access really simple tools to improve their oral health. So this is the Teeth Talk Girl, y'all. That's what she is on Instagram. And Whitney, I'm so thrilled that you're joining us today. And we're going to cover a lot of really good, I think, practical things for a lot of parents. And like I said, if you have kids, like the teenage years, they need to just follow you because you make dentistry actually kind of hilarious and fun.
Oh, well, thank you. That was very nice to say. I'm all about making things simple and easy, and we don't need to, of course, everything I do is based on science, but I don't want it to sound so sciencey and confusing and let's just get to the easy point and what can we do at home? Everybody's busy. That's what I'm always thinking in my mind. Like people just want a quick answer to make it as simple as we can. So I'm all about that. So that's what we do.
I love it. Well, maybe you can even start there. Like I mean, you've created such a platform, so many resources. I was actually kind of blown away at how much you offer people, but what was it that got you into this that really made you feel passionate about sharing what you know about oral health with the masses through social media, especially?
Yeah. So when I graduated from dental hygiene school, when I graduated, it was 2015, you had to wait until your license arrived in the mail. So it was like a paper license before you can work. And so I was waiting and I was just so eager. I felt like I learned so much in dental hygiene school and I couldn't wait to have patients of my own, but I couldn't have patients until I had that piece of paper. And so I randomly just made a YouTube video. I was like, oh, maybe I remember like sending it to my mom and being like, at least she'll learn something. And I was like, I don't know if anyone will watch. And to my surprise, people watched. It was a dental health YouTube video. It was all about mouthwash. And I was just, a lot of my patients in school, when I was in clinic at school, they would always ask about mouthwash. That was a hot topic. So I was like, I'm going to make a video about mouthwash. If they were asking, people might be searching it, right? And then the rest was history. People asked me, they just kept asking for more, like do a video on this topic, do a video on this dental topic. And there were so many dental topics. And everyone always asks me, are you going to run out of dental topics? And I'm like, no, you wouldn't believe. There's still, not until recently did I even make a wisdom tooth video, which is such a common thing that people talk about is their wisdom teeth. There's just so many cold sores, canker sores, any kind of oral health. It doesn't only have to be teeth. So I was so excited. People watched. I ended up getting my license, of course, as well. And so I started working clinically and making videos and doing a little combo of both. And here we are. That's what I still do.
It's so cool. You're kind of like, I mean, I don't know if this is like the greatest analogy, but you're like the Mrs. Rachel of like the dental world. Do you know of Mrs. Rachel? She's like a kid's like YouTube sensation. And okay. I only know about her because of the baby, which you just met on camera for a second before we started.
I might have heard of her.
Okay. I mean, she definitely like her, she's like in her element with kids, but anybody that's listening that has like a toddler, you probably know of Miss Rachel. And like Miss Rachel is literally crushing life right now.
That makes me so happy. I need to look. I feel like I have a few friends with kids and I feel like this sounds very familiar, but right away I thought you were going to say Miss Frizzle because that was like my era of what is that? The flying school bus? I don't even remember.
The magic school bus.
Magic school bus. Because I was kind of like, oh my goodness, Miss Frizzle, that makes me so happy. But Miss Rachel, she's probably just as cool. So I can't wait to look her up. But yeah, that's what it's all about is, of course, I want things to be digestible for both kids to learn and parents to learn and for, patients to learn if they're in the chair. And I just did a teeth cleaning and we're done. And we talked about a specific topic, right? I wanted to be able to be like, hey, if you want to learn more about this, like, watch my video, and now knowing that dental professionals, other hygienists, other dentists use my videos as well in the same, like, hey, I have a hygienist who, I want to refer you to watch online. Like, it's just so cool to help more than one person at a time, right? I could help a bunch of people all day. And I'm like, yes, like, so yeah, that makes me happy.
I really do
Rachel's
love that.
one of my favorite names, by the way, too. So
yes.
I'm very excited. I really am going to check her out after this.
You're going to be like, I can't believe that girl compared me to Miss Rachel.
No, it's going to be amazing. I love it.
But what's cool though, okay, so you are a dental hygienist. You're actually working on patients every single day. So you're not just like a YouTube sensation. Like that is something that's been birthed out of the passion of what you do and helping people. But I think that there's something really important to realize, because a lot of people are getting their health information from influencers and like all of these different people that seem to have a lot of opinions, but they don't have the clinical experience. They're just kind of attaching themselves to maybe a trend or something that's more viral because it gets a lot of views and likes and stuff like that. And, listen, I mean, I'm in the social media space too. Like it's a whole animal in and of itself. But what's important to realize is the discernment you have to have in the sources that you're getting your information from, because it's very easy to just see something that looks really good, like the shiny object syndrome, and then think it's Bible. And when in fact, there's really no scientific data. There's nothing definitive behind it, no solid framework that you can really say, yeah, that's actually a good decision for my health. So you have to be able to filter what you are watching and especially what you're consuming, what you're applying to your life. So I love that you have the clinical experience. Like I see the dentist chair in the background of your picture, like you're like doing it. And I think that is important because you're you're working on people's mouths and you're seeing them get better. You're seeing these strategies actually work for them. So I would love to ask you, in what you see with oral health in general, how is it tied? And we've, like I said, we've talked about this a little bit in some other episodes, but I'm interested in your opinion. How is oral health connected to the whole body? Because there's probably a lot of symptoms and conditions that can come back to poor oral health, I imagine.
Yes, so many. There's evidence of so many conditions. So there's the oral systemic link, right? We have really good data showing that there's a connection between the health of your mouth and the health of your overall body, right? Your immune system, heart disease. We have numerous studies showing that gum disease can increase your risk of heart disease, diabetes, kidney disease, Alzheimer's, a bunch of other conditions. So what you do when you're brushing, flossing, taking care of your teeth, it's not just about cosmetics, right? A lot of us, especially with social media, it's all like, how do we get white teeth? How do we this? We just want them to look good. But it's more about cosmetics, right? It's about keeping your mouth healthy so you could keep your overall body healthy. The mouth is the gateway to your entire body, right? And one thing, just when you were saying about all the wild stuff we see online, I was like, I need to share this. I was talking to a patient about this recently because they were like, oh, do you have a TikTok? And I was like, I do, but I'm not like a TikToker. I was like, I've been seeing more bad things than good about dental health on TikTok. One example, just to say the things that are out there and that people just trust because they see people doing it. People filing down their teeth with nail files. Have you seen this one? Sorry, I know this is not oral.
Oh my gosh, no, this is so important. This is like, because there are so many young people that, I mean, we saw stuff with like Ozempic, like guys, there's so many different trends where people are like, oh my gosh, that's going to fix my weight problem. Oh my gosh, it's like all these like quick fixes. And I'm like, do we have any idea what we are actually
there's so
trying to push here?
Yes. So oral systemic link, I love it. I want to talk so much about it. But yeah, the filing the teeth down, I just had to say, because, you can file when you file away tooth enamel does not grow back, right? So people, and a lot of like younger people were doing it because they were making the vampire like fangs. They wanted their canines to be pointy, or they were filing them down so they're all the same. Every tooth is the same like level. I don't know. It was concerning, but I had patients come in and ask me before, hey, Whitney, you do all this stuff. Like, should they asked me before they did it. So that made me feel good. My point is the people who don't ask, so that is a huge reason I'm doing what I do. Cause I'm like, I hope when people are scrolling through, they do find some true things. I always try to make a debunking video to, hey, by the way, don't file. If you've been seeing the nail file thing, don't do it, stuff like that. Anyway. Okay. But back to the oral systemic link. No, yes. That's and having said that, everything you do in your mouth directly relates to the rest of your body. So that's another huge reason why I do what I do.
Yeah, I've been the filing of teeth. Oh my word! I
I
mean,
just,
if I see my older kids doing that, I'm gonna die. I'm gonna be like, "Where are you watching? How are you accessing TikTok?" And I'll know where
yeah.
that's coming from.
Yes.
Oh, okay. So systemic health,
Yeah.
you're so right. You know, gum health,
Yes.
all of these things.
Yes.
So when you're doing dental cleanings, you're working on, and I imagine you see, you know, a lot of young people and youth. Like, what is it that you're seeing that's seems to be a common challenge for people orally? Because there are always patterns. I always find that in
Mm-hmm.
working with clients, I always start to see similar patterns among
Mm-hmm.
people, and it changes over the years. Is there
Mm-hmm.
something that's kind of alarming to you, or something that you're seeing that you're like, we're missing something here? People
Mm-hmm.
really need to pay attention to this, because if they don't, we're going to start seeing a lot more problems down the road.
Mm-hmm. I would say 100% is bleeding gums. So a lot of people come in, so many people come in, um, and they're like, "Hey, my gums bleed, just so you know, be gentle." And I'm like, "No, that's not how it works. That's not it's not normal for gums to bleed. That shouldn't be something that people just come in and say, by the way, my gums bleed," just and then like overlook it like it's normal. It's not normal. So that's probably my number one thing. The amount of people who think bleeding gums is okay. There's ways to make them stop bleeding, and it's gum stimulation. It's keeping them clean. There's a bunch of things, but
Yeah.
I think education is key, right? And so much of dentistry, as all health, is individualized, right? We could give so many generalized statements, which I'm happy to give. But my message I always tell everyone is you have to see your individual dentist and or dental hygienist so they can figure out what's going on in your individual mouth, why your gums are bleeding. I can tell you some reasons why they might be bleeding, but with trial and error, it's so hard if I can't measure your gums and see the periopocketing and take x-rays and see the level of your bone, see if there's bone loss. There's so many factors that goes into finding out why they're bleeding. But my point is, it's fine if they like you flossed really hard in one spot or you poked yourself but if you wake up and there's blood on your pillow, or if you just brushing your teeth makes all your gums bleed, there's a problem, right? So, I mean, flossing shouldn't make them bleed either, but flossing, that's a whole thing we can talk about. It takes some time to almost like get them work out your gums enough so they won't bleed when you floss, right? If your gums are bleeding because you're not flossing, they're not bleeding because you're flossing.
Okay, that was going to be my question. Is it because of the people not flossing? Because that's what I've noticed. If I miss
Yes.
a day or a couple days or whatever, the next time that I floss, I almost always notice that at some point, somewhere in my mouth, my gums start to bleed whenever I do. So that's always for me. I'm like, I know when I'm flossing regularly, I don't have the gum bleeding. So for all of y'all that try to skip the flossing, here's your dentist yelling at you through the podcast.
And that's what I always compare it to too, is like working out or doing cardio or lifting weights. If you're a runner or something, if you skip a few days of running, that next day you go run and you're like, oh, a little out of shape already. Like just skipping one day, it's the same with your gums. You really feel like, oh, I skipped a day. My gums are already getting, I don't want to say the word lazy, but they're already feeling like they took the day off. They don't need to be firm. Healthy gums are pink, firm, stippled, right? You want them to almost look a little stippled. Unhealthy gums are swollen, puffy, bulbous, red, bleeding. So I always say, like, one day of not flossing, they already start getting a little swollen, a little puffy, because now they're like taking the day off. We don't need to be up in like a muscle man looking. I always use visual, so when I'm saying this without visual, it's like silly. But yeah, it's muscle man is healthy, and then I always have my like person laying on the couch is not healthy. And that's the same with the gums. Mm-hmm.
Yep. Oh, totally. Okay. So you mentioned how important it is to have a comprehensive dental exam. Can you walk us through what that looks like, or what it should look like?
I love that.
Because I've noticed that it varies from one dental office to another sometimes. So what is it to you that makes a comprehensive exam suitable for maintaining really good integrity of your oral health?
I love that. That is such an awesome question. And I always want to say before I say, I'm going to say the basics of the standard of care. And I do believe the standard of care will keep your gums and your teeth at amazing health. You will be at a good level of health. If your dentist does more than this, great. That's awesome. Maybe they invested in some more, advanced technology or, innovations in their office. But if your dentist does less than this, that's when I would question why do they do less. So the number one thing I always say as a dental hygienist is make sure they're checking your gums. I know we just talked about the gums, like, so you're like, wow, this girl is passionate about gums, but the gum health is where it all comes from. Of course, your teeth are important. We know that when we're checking for cavities, if the only thing they ever say is, oh, no cavities, you're good. If it's a kid, that's different. Of course, kids don't have as many, like a little kid, like, yeah, the big thing is no cavities. But when you're an adult going in, you want to make sure they're really checking your gums and, of course, your teeth. Your gums they have all the little blood vessels in there. We know, right? The gums are what's connected to your heart and all the other organs in your body. So you want those gums to be healthy. And so the gum check, some hygienists and or dentists will say it out loud, but some won't say it out loud. So just because you don't know if they're doing it doesn't mean they're not doing it. But they're checking your gums with a little ruler. It's called a perio probe. And they go around and sometimes they'll call out numbers 3, 2, 1, 1, 2, 3. And they check the little space between your gums and your tooth on every single tooth. So they're checking for gum disease. They're checking if there's any space that's not within normal limits. The space should be between 1 and 3 millimeters. If you're interested, this is like extra knowledge, but I just think it's interesting to know what the numbers mean. You want it to be between, what they're checking is making sure it's between 1 and 3 millimeters, that little space. If it's a 4, they'll usually let you know maybe you have some inflammation, you're due for a cleaning. It's not the end of the world. But 5 and up, if you have a lot of 5, 6, 7s, when they're calling those out, that's when we need to start figuring out maybe what's going on, right? Is there gum disease happening? Do you just have severe gingivitis? Is it just really puffy? So that's when you have to decide. So make sure they're checking your gums. I've had so many people online tell me, what's that? I've never even heard of that, So, again, they might be doing it and not telling you. If you have amazing, healthy teeth, they might just check really quick and you're good. So don't worry. That's my number one thing. Make sure they're checking your gums. 2, I know x-rays are sometimes like a stressful thing for a lot of people for a lot of different reasons, right? You have to pay for them. They're sometimes uncomfortable. Some people are worried about radiation, but minimal, we practice ALARA, as low as reasonably achievable. If you're getting x-rays at some kind of maintenance, whether it's once a year, once every 2 years, whatever you're comfortable with, don't do it once every 10 years. You can miss so many things that could have been prevented. We can find things when they're small before you have a bombed out tooth or before you have bone loss that we couldn't see or we couldn't measure, right? We can catch it when it's small, and things are always easier to catch when they're small and better for your overall health because now it's not traveling to the rest of your body. So period charting, x-rays. And I would say my last thing is, of course, I got a million things, but the standard of care is make sure they're checking for oral cancer. I know a lot of people will be like, oh, I didn't know if they're probably doing it. Don't freak out that your dentist isn't doing it. Like they're looking around, they're checking your palate, they're looking at your tongue. If they're touching your tongue with any gauze or with the mirror, they're probably checking it, checking your cheeks, the sides of the vestibule of your buccal mucosa and all around your tissues in your mouth. We're in your mouth for so much longer than a doctor usually is for exams. Yeah. We can really see if there's any suspicious lumps or bumps anywhere in, visible. We can't go all the way down your throat, but we can check your throat as much as we can. I always like to palpate around a little bit too. Again, if you're not sure if they're doing it, just ask. Be like, hey, do you check for oral cancer? And they'll be like, oh yeah, I always do. And then maybe they'll tell you why, right? A lot of times dental hygienists and dentists might not even tell you they're doing it because they don't want to get you nervous, right? We see so many people like, why are you checking? Like, so they get nervous, and we'll only tell you if we see something suspicious. So those are my 3 things. But okay. I mean, yeah.
That's great. I have noticed that when I've gone in, like even checking like lymph nodes and stuff like that. Good. So what is it? What, like, I'm interested, like because lymph is so important. It's like the filtering system of the body. So, and I imagine like we'd have a lot of lymph in our face and our neck and our, just around like the structures of our mouth. So you ever see like symptoms associated with oral health that you notice in the lymph?
I don't see like observationally, I haven't personally. However, I have read a few things. Like I have seen some evidence on, of course, like how if you have severe gum disease, there can be increased inflammation of the body. And that sometimes affects your lymph nodes to be a little inflamed or the areas around them, right? So I have seen evidence-based stuff on there, but I've never seen it my own anecdotally. But I will say that in the mouth, when we're contributing any type of gum disease to any kind of oral cancer or things we don't want in the mouth. I would say the number one correlation there is smoking. Of course, we all know smoking is not good, but if you have gum disease, now you're at a higher risk for cancer and like a million other things in the mouth. So I would say the bigger correlation is, what are you doing to cause that, right? So there's always the root cause.
Yep. Guys, we just can't be smoking anymore.
I mean, it's so tough. And with vaping, it's so hard because I have been having more people like, oh, I don't smoke anymore, I vape. And like, I don't know, I'm of the mouth. I don't know about your body, but a lot of people are saying like, oh, it's better for my overall body. Maybe, I don't know, but it's not better for your teeth. It's actually worse because I've been seeing how I think some states it's banned, but the different sweeteners they use now in the vape, not only are you giving yourself everything smoking would give you, but the sweeteners are giving you cavities now too. That's the one thing smoking used to not give you is cavities. We'd be like, okay, you're in the group category for everything, like the cancer, the gum disease. But now with vaping, it's also cavities, and cavities can turn into tooth infections, So anyway, we all know smoking's not good, but it's a tough thing if someone smokes. They want to quit. A lot of people want to quit and they just can't. It's hard. So smoking cessation, there's so many good programs out there. I always, I have links in like all my videos for different smoking cessation programs. If it's something you're interested in, I always say Google smoking cessation programs and just try something new. There's all different ways to quit.
That's great. I do love your resources too. So if you're listening on her website, you even have resources where people can find like practitioners, everything from budgeting for dental cleanings, you've got everything on there. So you can understand okay, here's the investment. Cause dental insurance, we don't even go down, what even is that? Make it make sense.
Exactly. And that's another thing in all my videos. People are always saying, great, she's telling me to go to the dentist, but I can't afford it. Now what? And that breaks my heart because I'm like, you're right. And I'm so glad people have commented this because, it's not what we learn in dental school. We learn about everyone who comes to the dentist and how to help them. And then I started realizing, what about the people who can't get to the dentist? So, once you get into real life outside of school. And so that's when I was really passionate about, I have a video, it's called Affordable Dental Care. So no insurance, no problem. If you search it, something like that will come up, Teeth Talk, no insurance. But there are ways, there's dental schools, there's dental hygiene schools, they're looking for patients. If you need access to care, there's health clinics, there are a lot of great, really good opportunities for really good dental care in every area. You just have to search, where's my nearest dental school or dental hygiene school, and you can find access to care. But a lot of people are unaware of that, right? So we're trying our best I just want to make the information accessible to all, and then you can go from there. And then one step, I have a lot of goals in my future, but that's my first step, is making that information and the education accessible.
So good. And I think a lot of people, it's like the dentist is like getting the oil changed in your car. I'll stare at the light for a good 2, maybe 3 months. And I'm like, man, I'm really pushing it. Actually, currently my car is way overdue for an oil change. And I just, it's until something breaks, I'm like, I probably got another week. I'm good. So
I bet that's such a good analogy to teeth though.
I know. And it's terrible. I am better with my teeth than I am with my car oil, if anybody was curious. But, it is a lot of times we wait until the wheels are falling off and we just have to do better. So this is actually maybe a good segue then. Yeah. What are best practices at home? Because as much as we want to be every 6 months, do you recommend, is it 6 months is the time for a comprehensive oral care cleaning? What are your thoughts on that? And then we'll segue into best practices for home.
Sure. So yes, at minimum, everyone should be going every 6 months for an exam and cleaning. However, if you have any gum disease, gum issues, gingivitis, they might recommend, again, it's all on an individual basis, if you even just build up quick. Some people just build up tartar and plaque really fast, right? It just depends on the pH of your mouth. There's so many factors, again, that we can get into the science. And I do love talking about the science as well, but my background is in biology and chemistry. But but just simply, some people's mouths are not on their side and some are, right? Like it just depends what's going on
Yeah.
in your overall body. So if you do build up quick, or if you have gum disease or gingivitis, sometimes we do recommend you come in one extra time a year. I have a lot of patients on a 4-month recare. So it's every 4 months instead of every 6. So they get that one extra cleaning. If you have more severe gum disease than usually, or if you just had a deep cleaning, a scaling and root planing, if you are really we're trying to maintain the health of your gums, then it's every 3 months. But having said that, generalized, at least 6 months, do that. And if they tell you otherwise, then decide why. But then at home, what you do in between those 6 months is just as, if not more important than what we could do for you at your 1-hour appointment every 6 months, right? So my big thing is habit forming. And I do work with Bettermouth. It's bettermouth.com, and it makes me so happy to work with them. It's kind of like an app, but it's an interactive platform that helps you stay on routine to make sure that dental problems don't become problems in the first place with the prevention, right? Every 6 months, in between that, every single day, you have to just simply brush and floss. And I know that sounds so simple, but I have so many patients that tell me they only brush once a day and they floss once a week. You know, you're supposed to brush twice each day for 2 minutes each time, and floss and or water floss and or proxy brush, something to clean between your teeth at least once each day. And Bettermouth is what helps people stay on track. I love it. I have so many patients. Oh, also one more thing about that I saw when I started working with Bettermouth. It's like an oral health coaching program, right at your right on your phone. It's awesome. But when I started working with them, I looked up how there's statistics out there showing that 40% of Americans only brush their teeth once a day. And like, we really should be brushing twice. It only takes 24 hours for plaque to harden into tartar. And when plaque hardens into tartar, so plaque is the stuff you can brush off. It's like that slimy white stuff on your teeth. Yeah. Easy. We brush and floss it off. When it starts mineralizing and calcium, it hardens into tartar. That's when that stuff's stuck on your teeth for the next 6 months, or, you know, whenever your next cleaning is. Only your dental professionals can get that off with their professional scalers and ultrasonic, different instruments, dental instruments. So we want to do everything we can for that plaque to not turn into tartar, because the tartar is the stuff that has the really bad bacteria associated with it, and it could go underneath your gums, and that's when we get into the gum disease issues. And so yeah, my big thing is really just brushing twice each day, flossing and or cleaning between your teeth at least once each day. I could go into more details about like what the tools you should use, but that's my main thing. I love adding a tongue scraper as well. Anything to reduce any kind of bad bacteria in your mouth where you're scraping off. If you've never used a tongue scraper, the gunk you see on that tongue scraper will make you feel so good. You're like, wait, that's not bad. You tongue scrape. There's a bunch of extra things you could do, but I just seeing the statistics that almost half of the population doesn't brush twice each day. Let's start there, you know?
Yeah. Wow. Okay. That statistic is alarming.
Yeah.
I mean, maybe my children fall into that statistic, because I'm pretty sure if I didn't remind them 2 times a day, like, did you brush your teeth? Did you brush your teeth? I'm like, at what point does it just stick to them? That's just, I mean,
it's hard.
Wow. And here's the thing. Okay. So if you're not brushing, flossing, and you've got that plaque buildup, and this is something we can just jam on because it's so important. And I've seen this with clients over and over again, because of the exchange of your gut, right? And the bloodstream, all the bacteria, all of these things going systemic, meaning they go to every other place in the body, especially affecting your guts. When you're swallowing all the time, like tongue scraping, 1000%, I tongue scrape every single morning. Like, I can't not tongue scrape. Like, it's once you start, like, you have to do it.
Yes.
But that being said, you are reseeding your gut with bacteria. So you're essentially just contaminating the same thing over and over again. It would be like having mold in your house, and maybe you scraped a little bit of mold off of one area that's visible, but you've got mold behind the walls everywhere else. It's still circulating. So guess what? The stuff that you see is going to come right back. So you have to be able to address dysbiosis in the mouth. Otherwise, you are going to have SIBO. You're going to have all types of bacterial dysbiosis, and then you'll have gut issues. You'll have inflammation. You'll feel bloated. I see it all the time with people. And the oral health has to be addressed as well as the gut. You can't be taking all of the antimicrobials, but then your mouth is a hotbed of bacteria. So you've got to be able to have both. Do you see people that deal with, because like when you said some people have to come back more frequently, I think there's an underlying infection that's not being addressed, that's basically getting repopulated over and over because that plaque they're biofilms. Like what you don't realize is like that's where bacteria creates a little shield, and they do that in your mouth. They do it everywhere in your body, but your teeth can develop biofilms. That is like a first red flag. If people are like, gosh, I'm just constantly building up plaque in my mouth. I'm like, well, we got some bugs we got to deal with.
Yeah. I mean, it's inevitable. There's always going to be some plaque, right? It's always building up. There's always bacteria. And that's when I get into the mouthwash stuff too, because it's like, there's good and bad bacteria. We all know, right? And some people overdo it with the mouthwash. And if you're overdoing it with the mouthwash, you're not only killing the good bacteria, but you're also you're not only killing the bad bacteria, but you're also killing the good bacteria. We don't want that either. We got to work with something. So yeah, stabilizing, maintaining, trying to really, like you said, get the bugs, what we need there and the ones we don't want there is really, really important. But yes, I see a lot of correlations with anyone who needs to come in more frequently. It is generally because they're struggling with gum disease, right? And gum disease it's a bacterial infection in the gums, right? And so it's something we want to get rid of, but oftentimes that's where it gets real tricky with dentistry, because it's once you have bone loss, generally enough bone loss, not gum recession, not just your gums receding, but when your bone is actually lost that holds your teeth in, the width of the bone, you know what I mean? Not just a little bit of recession, but it generally can't grow back, right? You can't just bring a bunch of bone back. If you have 8 millimeters of bone, we have to just stabilize where we are and not let it get worse. And that's, I want to prevent people from even getting to that point, because you're in a whole different category. That's periodontal maintenance now. That's, that's soft tissue therapy. That's no longer prevention. That's therapy. So my big passion is, yes, let's just not even get into that category. Let's make sure we're removing the plaque biofilm, removing everything so it doesn't harden and it doesn't get into all that other bad stuff that we don't want to deal with. I never want to make anyone feel bad. If you are someone who needs to go in every 3-4 months, that's okay. Just make sure you keep doing what you're doing, right? Don't let it get worse. But if you are going every 6 months and your dentist is not going to do anything, any problems, you want to stay that forever. Let's stay with the 6 months. So yes, that's a huge thing. Removing it, manual removal of plaque with the brush, with the floss, with the water floss, or whatever you're using, is so important. I have so many patients, again, that say, oh, what mouthwash should I use? And I'm always like, it's not really about that. Like, you're just swishing. That's not removing. You need to physically remove the plaque biofilm, right? Are there some people who can use an anti-cavity because they're really cavity prone? Sure. Are there some people that are really struggling and trying to stabilize their gum health and need to use an antiseptic for a little bit? Or sure. But yeah, people that just use it to use it, I'm really passionate about, make sure you know why you're using mouthwash. Don't just use it to use it. Yeah.
So that's a great point. Yeah. And it makes me think too, because so many of our listeners are super educated on natural health. That's our jam. So what is it that you see that you feel like works or maybe doesn't work? Maybe it's being, it's kind of being positioned as something that really works. Like it could be coconut oil pulling or activated charcoal or hydroxyapatite. I always love some of those practices because I think they can be helpful, but I'm interested in your opinion in seeing whether or not it can reverse and heal symptoms of breakdown in the mouth.
Sure. I could go through all three of those. So oil pulling, I'm totally fine with people doing it. I get really nervous when people tell me they replace brushing and flossing with it. So I do not agree with, a lot of people will be like, no, it's fine. I see the research. I don't need to brush and floss. I just swish. And I'm like, here's the thing. That is not remove it. You have to use a toothbrush. You have to clean between your teeth. I know maybe the oil's doing something, but it's not scraping. You can miss things with you when you floss. Imagine what you're missing swishing. So I think it seems like there's a lot of great evidence with oil pulling. But I haven't seen enough to tell people to do it, but I have seen enough where I think it's fine and it can't hurt. You know what I mean? Let's do it. I think it'd be awesome when there's more studies out there to really show everything, but everything I've read seems very positive. So I'm cool with that as long as you don't replace brushing and flossing with it. The second one, you said activated charcoal. I am very nervous about activated charcoal. It can be very abrasive to the tooth enamel. If you are brushing with charcoal toothpaste, always ask your dentist. Always tell them first, your dentist and your dental hygienist, so they can really watch for any enamel scratching. You don't want it. Your enamel it's thick most of the time. But once you keep scratching away layers of the enamel, there can be a point where there's no more enamel. And now you're at the next layer called dentin. Dentin is yellow. It's a yellow tint. So your enamel's white, dentin's yellow. I know a lot of people use charcoal for whitening. And so they keep getting whiter teeth because they keep scratching away the next layer of enamel. But then years go by and one day their teeth are just like, the charcoal's not working. And they're like, it's not working. It's like, you might have already got to your dentin layer. So be wary with just make sure. I usually don't recommend charcoal. I will say that. But if for some reason you really like your charcoal, maybe use it once a week or once a month, or talk to your dentist. But I generally don't, I'm not with the charcoal. Nanohydroxyapatite, sure, I'm cool with it. I think there's a lot of great, again, with oil pulling, I think there's a lot of great evidence out there. I just haven't seen enough to like recommend it. The American Dental Association does not recommend it yet either. I say yet because I'm hopeful that they do. It seems very promising. Yeah. There's a lot of great research out there. It's just not as much as other anti-cavity things that we have. But if someone is against fluoride and really doesn't want to use fluoride, I do recommend fluoride. I've seen observationally too many people, especially kids, when they just stop fluoride cold turkey and they don't use anything else, like they use something very natural that doesn't even have, if you're using xylitol in your toothpaste, that's good. But I've seen a lot of bad situations where the kid comes back in 6 months and now they have like 3 or 4 cavities and they've never had a cavity in their life. You know what I mean? So I'm very nervous about removing fluoride unless you're replacing it with nanohydroxyapatite. That's the one that I haven't seen anything bad happen when people use nanohydroxyapatite. So it seems like that one's okay. And those are my 3. Those are the 3, okay. Right?
Yeah. Would you say bentonite clay is kind of like similar with the activated charcoal, where it's just too abrasive to be using on your teeth?
I need to look into that one. Okay. So I've heard this is very recent. Like in the last week, I've seen some things about people using that. Yeah. I haven't looked into that one enough. I'm going to look into it. I don't know. The charcoal is like a huge buzzword in dentistry, but that clay, I was like, you just said it. And I was like, oh, I just saw this recently, but I don't know it.
Yeah. Well, there's always like, I'm always looking at like super rogue, like off the beaten path stuff. And
which is fun. Yeah.
Yeah. And so, but I'm always interested to see like what has somebody's experience been with it. Because that to me is what counts. Like, in talking to people and helping people over the years, like I only want to make recommendations like you, like I want to be able to know that if I'm giving somebody a suggestion, like I've actually seen this work before. Now, is it going to be the one thing that changes your life and works for you? Like we're all bio individuals. I can't make that guarantee, but I'm not just going off of something in a textbook, because we all know conventional medicine is far from hitting the mark on, what's being taught just across the medical system in general. So, I'm always willing to look at other options. So, okay, well, I want to ask this. So electric toothbrush versus a standard toothbrush. What are your thoughts on that? Are people doing it wrong? I feel like nobody uses their electric. If somebody has an electric toothbrush, like because we're so used to like scrubbing our teeth down, I feel like maybe we're doing this all wrong.
No, a lot of people. Yes. So I do recommend electric toothbrushes to almost all of my patients, mostly because most people use manual toothbrushes wrong. The regular one, like you said, most people are scrubbing just either too much or not enough, or it's easier to use a regular manual toothbrush wrong. It's easier to use an electric toothbrush right. So that's just the reason, right? But if you really like your manual toothbrush, that's fine. You can effectively clean your teeth just as good as with an electric, but you have to make sure you're doing it right. And I do have a video, of course, that shows how to do it, or of course, ask your hygienist at your next appointment. But electric toothbrushes, they do the work for you. You just have to hold it in the right spot and you move it from tooth to tooth. Some people do use electric toothbrushes wrong because they're also brushing back and forth with the electric toothbrush, and that's too much, right? You have to just guide it along from tooth to tooth, let it do the work for you. Whether it's a vibrating one or a spinning one, you still just want to make sure you're wrapping around each tooth, don't miss any spots. I do recommend you always hold it, whether it's a regular toothbrush or an electric, always hold it at a 45-degree angle. So you're almost like pointing it up toward the gums on the top teeth or down toward the gums on the bottom teeth. You really want those bristles to be cleaning that little space that we were talking about where the periodontal is. There's that little space between your gums and your tooth. You don't want plaque getting in there, or the biofilm, right? You don't want the biofilm just sitting there. So you just kind of go from tooth to tooth and it does the work for you. So yeah, I'm all about electric, but if you want to use manual, that's fine. Just make sure you're using it right.
Okay, that's such a good point. I'm for
Yeah.
sure, like full disclosure, I
Yeah.
definitely do not use my electric toothbrush, right? But it's that the problem is I've just been doing it wrong for so long. That is like my automatic default. And by the time
Yes.
like first thing in the morning or late at night, like I'm in complete autopilot. So there is no like
I hear you.
brain
At least you're doing
activity
it.
going.
No, yeah, at least you're doing it. And that's another thing with Better Mouth. You could do like a 30-day Better Mouth program that bettermouth.com.
Okay.
And it goes over like there's one day how to use your electric toothbrush and there's visuals showing you like exactly. So like, and you watch it or listen to it while you're brushing those 2 minutes, in the morning and at night. So if
Oh.
you're unsure, like it's kind of like you're having an oral health coach there in your bathroom. And I love that because so many patients will tell me too. I keep saying like so many patients will tell me, but it's good to know so many patients will tell me like, I wish I could just bring you home with me so you can brush and floss at night. Like they're like, because it's like easy when someone else is doing it. And then you're like, shoot, what exactly did they just tell me to do? Right. So it's nice to like have that there when you're doing it. Cause yeah, we're never sure. That's how I feel with my hair too. Side note, when I get my hair done, I'm like, can you come with me to like do my hair every day?
I mean, why is that like nobody can ever do your hair? Like
So
I'm the
hard.
same way. It's like we can't do it on our. I'm like it will never look the same. I could have the right tools. I could have all the right stuff, and my hairdresser makes it look one way, and I'm like a like severe Pinterest fail. Like it's like the meal that
Me
like
too.
looks awful compared to the picture of the meal what it should look like.
We do. So yeah, we are hoping that, yeah, it's just, we do the best we can and that's all we can do. And always ask, never be afraid to ask. I'm always afraid to ask like dental, like I was always afraid before I was in the field. And now being as on the clinician side, I'm like, I wish patients asked me everything. Just ask me anything. Like, I want to help you. I'm here to help you,
Yeah. I mean, guys, listen, you shouldn't be afraid to ask anything after hearing the statistic that half the population isn't brushing their teeth. So
100%.
There
You're
is
never
no
going to be
shame
judged.
now.
No, there's never judgment. And we want to help you. That's the thing too. Sometimes when someone comes in with a lot going on, right? Their teeth they have bomb dot teeth, they have, gum disease. When there's a lot going on, I see that as like I'm so ready to like help this person. It's like a smile makeover. You know what I mean? Never be worried that we're judging you. If anything, we're excited to help you. I'm like, oh, you got something for me to fix. I'm ready. So never be worried about like, oh, I'm embarrassed. I don't want them to see. That's what we're here for,
Yeah, that's so great. I can tell you're super passionate about what you do, which makes I mean, that really takes down a huge barrier because nobody likes going to see anybody that is doom and gloom. And most experiences, I mean, just with health, especially if you're dealing with something that is undesirable, it's like the whole experience can really be subpar if, you've got somebody that is just like not an encouragement. So I can just feel your energy for this, like through our little Zoom platform.
Yay. No, it's true. That's what it's all about, right? I really feel, health and wellness and everything. We're all just trying to help each other out. That's what we're trying to do. And and I just feel like that makes me happy when people are not afraid.
Yeah, this is so good. Well, you have a ton of resources online, and I love that you are also very like philanthropic too. Like you're trying to give people the tools so that they can help themselves, and that's what this platform has always been about: is giving people resources and giving them tools so that they can make better decisions for their health. So, give us the rundown, and then guys, like I said, I mean, just follow, like your Instagram is hilarious and YouTube. So there's so much fun stuff. I mean, you talk about like gum. Like you said before we even started recording, there's so many topics, like different ways that you can talk about your oral health. And I love that you've created all these little small videos because you can actually kind of filter like the topics that are relevant to you. So I think your Instagram page is like, it's a great resource for people because some things just might not be relevant to you right now, but other things might be. So it's like a little mini search engine. So tell people where they can access you and some of your resources, learn a little bit more about you and what you're doing.
Thank you. Yes. So teethtalkgirl.com is my website. And we do have a database there where it's like you could type in, you can search any toothy topic you can think of, any oral health topic. There's, you could pick by letter what it starts with, A, B, C, D, or you can just type it in and see what we have. We probably have it. I've dedicated my whole life to just making sure that we have resources when people ask questions who don't have access to care to see their dentist or dental hygienist. So you can get an idea of what's going on, and now you know exactly what to ask when you do have your appointment. So yes, teethtalkgirl.com is my website. You can also check out my YouTube channel, youtube.com/teethtalk. My Instagram, like you said, is @teethtalkgirl. And then also I'm really passionate about working with Better Mouth, which is bettermouth.com, that helps you habit form and form routines to really, if you're ready to really make the best oral care, perfect care plan for your mouth, your personal mouth. There's a quiz you can take. It's like a little quiz, and it personalizes it to what you need. Like, are you worried about staining? Are you worried about cavities? Are you, what do you want to improve with your mouth? And Better Mouth helps you get there. I think those are them.
Yeah, that's so good. Well,
thank you.
No, this is super helpful. And like I said, I commend like all of your efforts to try and provide all of this. I know how much work it is, like trying to put together content for people so that it's just an available resource for them. So guys, take advantage of it. Give her a follow. DM us. Let us know if this podcast was serving to you. We always love hanging out. The knees are here. Are you an 80s baby? Or are you younger? Because you seem young.
I'm 1990, so I'm right there.
Okay, you're okay. I was going to say you definitely look younger than me.
No. I feel like we're the same. Well, I guess I consider myself 90s. Yeah.
Yeah. Well, so
but I love the knees.
We're in the knees era because like it's like the Britneys, the Whitneys, the Courtneys. Yes. Like nobody has those names ananymore. So I kind of I feel like we were in the club of like maybe like 80s, maybe early 90s. So anyway,
I love it.
But we'll be signing off. The knees are signing off for today. But guys, thank you so much for joining us. This was so much fun, Whitney. Thanks for coming on the show. We're going to link all of her resources in the show notes for you guys, and we will see you on the next episode.